Whether you're pregnant or not, you've probably heard a lot of different opinions and recommendations regarding sleeping position in pregnancy, and let's go ahead and clear some of that up in this video. Welcome back to the New School OBGYN. My name's Eric Schmidt. I'm a board-certified OBGYN. It matters where you get your information, so always cross-check your sources. The idea behind the sleeping position in pregnancy and why it matters stems from the idea that there's two major blood vessels that run through the abdomen, and the growing baby could potentially compress these blood vessels if someone were to lay in the supine or back down position, and that weight of the pregnancy is potentially pushing on these blood vessels. Veins in our body are more compressible, and so the wall is thinner and it could easier be blocked off, whereas arteries have thicker walls, higher pressures, and it's harder to compress an artery. And so the idea is that if a growing baby and growing uterus and someone's laying on their back in the supine position or back down position, the weight of that pregnancy could compress that vein and decrease the return of blood flow from the body to the heart. This is where a lot of the recommendations come from when someone tells you, you shouldn't lay on your back when you're pregnant, or you should lay on your left side when you're pregnant. And not necessarily all of that is true, and let's explore that a little bit. So pregnancy, in theory, could potentially compress these blood vessels, specifically the vein. However, there's a few things we need to take into consideration and not just assume all pregnancies at all stages will do this. This is mostly when the uterus is so big, when it is going on to its third trimester, because if we look at the anatomy here, the vein really only goes down to a certain point, especially somebody has to be in their 20s weeks pregnancy for the uterus to really be big enough and high enough in the abdomen to compress the vein. Also, there is the idea that, well, this is mom's blood flow. And so if mom's blood flow is compressed, then when it goes to her heart and to her lungs to get oxygenated, mom should feel those potential symptoms from that first, and so should be able to correct that that obstruction potentially if it were to be happening. And so what I'm saying is that it's reasonable to assume mom would have symptoms if she's having decreased blood flow from compression of her vena cava. So why do these recommendations vary so much? Well, there's not a lot of great evidence to support that sleeping on your back when you're pregnant, especially later on in pregnant, is dangerous or not. And so we often, when we're faced with this decision, we don't have a lot of great evidence in pregnancy, we often veer more towards a conservative approach. Let's review this. Let's again take a reasonable approach to this idea. Now, in somebody with a lower risk pregnancy, and especially in early pregnancy, and that includes conception through the second trimester, you don't need to worry about which position you're sleeping in. Too often I have patients coming to me in the first trimester and they're worried about their position when they're sleeping. Again, if we review the anatomy, baby isn't big enough and the uterus isn't big enough to even reach the vena cava yet. So your position then in that time of the pregnancy, first trimester and the second trimester, you really don't have to worry about your position. So now let's talk about when it might matter. And this is the early to mid third trimester, when somebody's getting around to 28, 30 and beyond weeks. Now the uterus is getting big enough to potentially compress the vena cava. And this is a time where I'm telling moms to be a little conscious of your position, especially if you're potentially laying on your back and you're realizing, hey, I'm a little short of breath. Alter your position a little bit. It could be potentially from the sleeping position and the compression. So for part of the theorizing of the blood flow obstruction, often people say, well, lay on your left side. So you get that pressure off the vena cava on the right, and that's a little excess. It doesn't really matter which side you lay on. You can lay on your right, you can lay on your left, it doesn't matter. And another point to give reassurance on is that if you by chance are, in your third trimester, you're sleeping at night and you wake up and you realize, oh my gosh, I'm on my back. How long have I been on my back? Just turn to your side. Your baby is likely doing just fine. And if you have concern, this is when you would do things like kick counts. And so try not to worry too much about that. Turn on your side or just prop yourself up to one side or the other and go back and have some rest. In summary, here are my reasonable approach to sleeping in pregnancy and the position. Now, in your first and second trimester, sleep whatever position feels best. And in the third trimester, consider adjusting. And it doesn't necessarily need to be all the way over on your left side or all the way over on your right side, on your hip and your shoulder. It can just be a thin rolled up towel along the back and hip to just prop yourself a little bit over one way a couple inches or a little over the other way a couple inches. You're not always on that hip and that shoulder, because that can lead to a lot of musculoskeletal type discomforts through the pregnancy, and it's a little bit excessive to be all the way over on one side or the other all the time. Again, the side, left or right, doesn't really matter. Sleeping in pregnancy is already really tough, and it is a treasured commodity. And so don't make it any harder on yourself with potential extreme recommendations one way or the other. Check your sources, talk to your provider to see what the best option is for you. On that note, in the future, we'll be talking about different ways to make sleep better in pregnancy, hopefully get more rest, because growing a pregnancy takes a lot of energy, and we all know how decreased sleep affects us. And so let's try and make that better in the future. All right, guys, thanks for listening. We'll talk soon.